Good evening, YouTube medics. My name is Graham Judd, and I'm doing another patient assessment tip. This will be tip number 4. It's been a little while since I posted a video, and that's because of the holidays, and I've been picking up a lot of overtime, so I've been quite busy. But I had someone ask me to post another patient assessment tip, and here it is. Today I want to talk about how well versed you are in your 12 lead rhythm interpretation. Now, I realize when we come out of medic school, it's been beaten in our head, beaten in our head, beaten in our head, and we're all top notch. And we do the ACS recertification every couple of years, and we're real confident with ourselves. But over the years, you begin to lose some of that information. And the reason is because many of these rhythms that we learn in school, we don't see every day. In fact, we rarely see them, if ever. Recently, however, I've been having lots and lots of unusual cardiac rhythms. Now, first and foremost, if you threw away your basic arrhythmias book, buy another one. It is a phenomenal resource that you can use to help you with your diagnosis on EKGs. If you run a patient and you're not real sure what you're looking at, it would be great to ask a doctor if one was available, but oftentimes they're not. You can't adequately assess your patient and the cardiac etiology if you're not familiar with it. So get the book. That being said, recently I've run some very unusual rhythms. I had a rapid AFib of about 180, 190 beats a minute, chemically cardioverted with cardizem. She then goes into a sinus rhythm with multiple PVCs presenting as runs of V-tach, and I had to give that same patient amiodarone. Gave 150 milligrams in 100 cc's of fluid over 10 minutes. A couple shifts ago, I had a lady whose P-wave, QRS complex, and T-wave were all exactly the same size. She was also presenting with multiple unifocal PVCs. So it was a sinus rhythm because there were P-waves, QRS complexes, and T-waves. But it was a very abnormal type of rhythm. I've seen one rhythm similar to it several years ago, which actually turned out not to be a cardiac issue at all, but it turned out to be a metabolic abnormality. The patient who had the very unusual rhythm had a blood sugar of 1900. So just to tell you a little bit about her condition. I've seen several V-tach patients recently. Seen people who have had cardiac rhythms that they weren't sure of, so they didn't treat the patient. But do yourself a favor, get the basic arrhythmias book and study it. The 12 lead is your friend. Use it on virtually every patient assessment. And I don't go so far as to say all patient assessments. Your BLS patients, some are very, very obviously BLS. We used to triage people. We would triage them as green, yellow, or red, and we had some patients who we like to triage as neon green. Those patients may not need a 12-lead EKG, but when you're going to do a patient refusal, do a 12-lead. When you have a patient with any type of unusual presentation, do a 12-lead. Any abdominal pain, any shortness of breath, any jaw pain, anything of that nature, use your 12-lead and know what you're looking at. This is Graham with YouTube Medics. Love you guys. Have a great night. Stay safe.